I think the hospital is really short
And
of
maybe
staff.
they're just too busy.
So they
Maybe
should
we
have
need more doctors.
doctors
Part for me,
on
you
duty.
get referred to a
was that
specialist.
transition.
Sometimes there's a very lengthy wait,
Children.
and you're fortunate perhaps if there's a cancellation, but that doesn't happen.
Which means a lot.
I don't provide much care for Sheila, but she does a lot for me.
When they're going off a CCAC service because they've become accustomed and dependent on it.
You move to a retirement facility, maybe as early if the home care and housekeeping care had been more available and more often.
They need to be better equipped to understand services available in the community.
I don't feel I'd be where I am today, tired a lot, if it had been addressed properly. And I think it was just the doctor were just too busy.
In our current environment, it's very difficult to put a shining light on problems in the healthcare system without that creating problems for the government.
I've seen so many doctors, pain specialists. I would say actively right now, I probably see about 6 or 7 different doctors.
I think there's a mutual ownership here. We need to own and understand our own health care. The primary care providers need to be our coaches and supporters for us.
Mom had no idea where her medical records were or where the doctor had gone.
For all of us, at one point or another, our primary care provider is our access point to the system.
And found all of Mom's medical records in a shopping bag underneath the passenger seat of the vehicle. So
I didn't know they were there.
I've been told to call one of the specialists anytime, and this is unheard of when you talk to other people. He has what you call a care coordinator.
Listening to the patients and families and caregivers.
He asks me questions that makes me wonder whether he even read the last report.
Involve them in the sorts of changes that we think need to happen.
People are afraid to express their feelings openly for fear that the doctors will respond negatively to them.
We've created a system where when you need something, go to an expert. I think you should go to an expert, but you need to know what to talk to the expert about.
Well, I don't feel you should have to complain. If you have symptoms and you say you have a lot of pain, I don't think you should. I'm not a grumbler.
I think what we have now is a rather passive group of patients.
I would be extremely worried about how smoothly this would all work if an elderly person did not have a family advocate.
In hospitals where I've worked most of my career, the biggest complaints the patient have is they don't know who to even go to get information.
But I don't want to burden the system.
If you continue to get that type of care and I get the care I need, I think we're very fortunate.